Hello, my name is Barb Opperwall. I'm a nurse practitioner with Trillium Palliative Services. We're here today to talk about palliative care and help you learn about it. I'd like to introduce you to one of my colleagues, Dr. Kayla Andres, who's going to give us this good information about palliative care. Hi, Dr. Andres.
Hi, thanks for having me, Barb.
The first question is, what is palliative care and how is it different from hospice?
It's a great question. Palliative care is specialized medical care for anyone with serious illness. The type of care is focused on providing relief from symptoms that are impacting quality of life and the ability to do what's important to you. So they may help manage any symptoms such as pain, shortness of breath, fatigue, not sleeping well, anxiety about your current medical condition to help you enjoy life more fully.
Who is eligible for palliative care and why would our healthcare providers suggest it?
So anyone with a serious medical condition is eligible for palliative care. So this can include conditions like cancer, COPD, congestive heart failure, dementia, stroke with functional declines, and even progressive illnesses such as ALS and multiple sclerosis.
What are the usual ages of your patients?
Yeah, so we see generally any adults, but generally I see patients ranging in age from about 30 to 95.
What are the most common types of things that you help patients with?
So we can help with managing pain, a lot of pain, and pain has different sources, whether it be from treatments or surgeries or cancer-related treatments. We can help manage COPD or heart failure, where shortness of breath, as well as we can help people with anxiety about their medical condition and help with sleep.
I think some of the things I really enjoy helping patients with include some of the things they're a little bit embarrassed to talk about. I really want people to be able to be comfortable around their bowel movements. Their bowel movements problems are not usually going to be dangerous for them, but they can really make them miserable. I'm also really interested in helping with things like sleep and itchy skin. There are so many things that we work with that help with symptoms. So when patients come in for a palliative care appointment, how does that go?
Yeah, so you can expect that your palliative care physician or nurse practitioner would help manage symptoms that are impacting your quality of life. So they'll get a detailed history about those symptoms that are bothering you and then use their expertise to treat it very specifically. You can also expect to help relieve some of the stress of living with a serious medical condition, as well as they should help give a better understanding of your medical condition and the treatment options available to you.
Where do you see palliative care patients?
We see palliative care patients in a variety of settings, including our clinic, which is seen here, as well as we see people in the hospital while they're hospitalized for medical conditions. But really, we'll go wherever you go. So if you are having a hard time leaving your home, we could potentially visit you in your home, your assisted living facility, or your nursing facility.
Now, does insurance cover the costs of palliative care?
Yes, most insurance plans, including Medicare and Medicaid, help cover the costs of palliative care visits. It's covered just like you see any other specialist, whether that be a heart specialist or a lung specialist. A palliative care specialist is just another team member.
Now, what is advanced care planning?
So advanced care planning is a process of understanding your preferences regarding medical care and help to choose a patient advocate or someone to speak on your behalf if you got too sick or too sleepy to make your own medical decisions. The goal of this conversation would be to help make sure that both you and your patient advocate understand what's important to you and what sort of medical treatments that you would want, so that if you were not able to make your own medical decisions, someone would be able to speak on your behalf, just like it was you speaking for yourself.
Now, what does palliative care add to the other care that patients receive?
While most medical teams are focused on treating the disease, their disease, palliative care focuses on relieving the symptoms of that disease. So they add an extra layer of support to you and your family and your medical team and help alleviate some of the suffering while your other medical team members treat that disease.
If we have palliative care, are patients able to keep their own doctors and nurses?
Absolutely. So we work alongside your medical team while you still go through treatment. So we just are added as an extra layer of support.
What if a patient changes their mind and wants to stop having palliative care?
Once you've started with palliative care, if you find that it's not working for you or it's not, you do not find that you're benefiting from palliative care, you absolutely have the right to no longer participate with palliative care. We ask that you let your palliative care team know so they can help transition care back to the rest of your medical team.
What kinds of questions would be good to ask your referring physician about palliative care if you think that it might be helpful?
Yeah, I would ask how they think palliative care can help and if there's any symptoms that they think palliative care could specifically help with.
If you're struggling with a difficult illness and if you're having symptoms that are making you uncomfortable or feel bad, we encourage you to ask your healthcare providers about whether palliative care is right for you. We find that talking to a palliative care provider early before you're in a crisis helps you to make better decisions and to feel better sooner. Thank you for the opportunity for us to share a little bit about Trillium Palliative Services.